there, Jen Fector here from Washington County Aging and Disability Resource Center. I'm the Elder Benefit Specialist here, and I'm here today to talk to you about Medicare. This is the first video in a series of videos. In this video, we're going to talk about Medicare Part A and B. The subsequent videos will be about supplement insurance, Medicare Advantage plans, sometimes called Medicare Part C, and prescription drug coverage. You should have already received in the mail your Welcome to Medicare packet. In that envelope, you should have also received a Medicare New Handbook and a resource directory. As an elder benefit specialist, I'm here to provide unbiased information about your plan choices. I can also provide tips on how you can compare plans. As an elder benefit specialist, I cannot choose a plan for you. I cannot make recommendations for individual companies, and I cannot enroll you in a plan. You ultimately are responsible for your own plan choices. You have to take the appropriate steps to enroll yourself into the plan of your choice. As an elder benefit specialist, I do not sell anything. The information that I'm going to present to you today is only for the use of the participants of this workshop and should not be redistributed. I'm just here to help you make an informed decision to your Medicare plan choices. You should have received a packet of information in the mail that you can use to follow along with this presentation. Your packet has been color-coded and includes information about Medicare and the private insurance options that coordinate with Medicare. We are already on page 2 of the packet. You can find the presentation attached to the center of the blue folder. Because Medicare information can be very confusing, I've color-coded the information to help you keep track of your options. Information found on white paper will be about the original Medicare program, followed by supplemental insurance on orange paper, Medicare Advantage plans on green, prescription drug coverage on pink, the Wisconsin Senior Care on purple, veteran benefits on blue, and finally the Wisconsin Medicaid program on yellow. President Lyndon Johnson signed the Medicare program into law on July 30th, 1965. At the signing, he accepted applications for President Harry Truman and his wife Bess, who were the first 2 Medicare beneficiaries enrolled. Medicare quickly grew to become the nation's largest health insurance program, covering about 61.4 million Americans in 2020. There are 5 ways to gain access to Medicare coverage. Medicare is health insurance for people age 65 and older, under age 65 who are found disabled by Social Security and satisfied a 24-month waiting period, people with ALS, sometimes called Lou Gehrig's disease, certain individuals who have been exposed to environmental health hazards, and people with end-stage renal disease. As a general rule of thumb, if you are eligible for a Social Security check, you have enough quarters of coverage or work credits to have earned Medicare. Those quarters of coverage can be through your own work record or through the work record of your spouse. For people who did not work or pay into the FICA system, they have an option to buy into the Medicare program. You should make decisions about Medicare at age 65, even if your full retirement age is later and you decide to wait to collect your Social Security check. Even though Medicare and Social Security are 2 different federal government programs, Social Security is the gateway to your Medicare coverage. If you are already collecting a Social Security check, Medicare enrollment will be automatic. You should expect to see your card in the mail 2 to 3 months before your coverage begins. For people aging into Medicare, coverage will begin the first day of the month you turn 65. If you are collecting a check from Social Security, you will be required to take Medicare Part A when you're first eligible. If you or your spouse are still working, you may have the option to decline Part B. There'll be more on that later. If you're waiting for full retirement age or later to begin collecting your Social Security check, you will have to contact the Social Security office to sign up for Medicare. Their information is listed below. You will have 3 months before, the month of, and 3 months after your 65th birthday to sign up. If you are a railroad retiree, you will sign up for Medicare through the Railroad Retirement Board. Some people choose to delay their Medicare enrollment. Be careful, you could be penalized if you do not meet the Medicare guidelines to delay. To delay Medicare Part B without a penalty, you have to prove that you are covered by a qualified employer group health plan through your own or your spouse's current employment. If you or your spouse are not actively employed and covered by that employer's coverage, there is a 10% penalty for each year you go without Part B when you are eligible. It is also important to know how your employer's health insurance will coordinate with Medicare. Be careful here. Some employer insurance plans will require you to sign up for Medicare Parts A and B. Medicare can coordinate with your employer plan. It will either be primary or secondary depending on the number of employees and the reason you're Medicare eligible. If you work for an employer with 20 or more employees, your employer's insurance will be primary. If you or your spouse work for a small group employer, that's 20 employees or less, Medicare will be primary to your employer plan. That means your employer plan may not cover a large portion of your medical care unless it has been processed by Medicare first. If you're younger and disabled, the number of employees required jumps to 100 before your employer plan would become primary. You must enroll into Medicare within 8 months from either the loss of the employer insurance or the end of employment to avoid the penalty. Many employers are now offering high-deductible health plans with an HSA savings account. An HSA account is a savings account that is set up specifically for medical care. Deposits into the account are typically pre-tax dollars taken from your paycheck, then set aside in the HSA account to be used to help pay for your medical care. If you are enrolled in a high-deductible health plan with an HSA account through your employer, there are some additional things to consider. IRS rules do not allow contributions to an HSA account once you are enrolled in Medicare. Remember that if you are collecting a Social Security check, you must take Medicare Part A. This means that you cannot collect a Social Security check and contribute to the HSA account. If you are not yet collecting a check from Social Security, you have the option to delay both Parts A and B. Make sure you are planning ahead. Medicare Part A will backdate your coverage up to 6 months or back to your 65th birthday, whichever is later. That means that you must stop contributing to your HSA 6 months before you plan to take Medicare if you delay Medicare coverage. You can, however, have Medicare with the high deductible health plan. You just can't make deposits into that HSA account anymore. Also, the money in your HSA account can still be used after Medicare begins. This is a sample of an old Medicare card. If you have a card like this, you should safeguard this card until it can be destroyed. Old Medicare cards included the Social Security number of the person who paid the FICA taxes for you to earn the benefit. In 2018, Medicare started issuing new Medicare cards to everyone on Medicare. The new card included a new number called an MBI number. The MBI number is a unique and randomly generated combination of numbers and letters. The characters are non-intelligent, which means that they don't have any hidden or special meaning. Your card also lists the parts of Medicare you are enrolled in and their effective dates. Medicare Parts A and B are the only parts that will be reflected on this card. Medicare Parts C or D are offered through private insurance companies. It is important to keep your card safe. MBI numbers should be confidential, like a Social Security number, and should be protected as personally identifiable information. Do not share the number with anyone other than your medical providers and the insurance companies you choose to do business with. Now that Medicare enrollment is getting closer, you may have noticed an increase in the amount of mail you are receiving. This slide was included to help you identify the logos for the government agencies that may be sending you important documents. The first logo here is for the Social Security Administration. Social Security sends out a benefit summary letter each December informing you of the COLA increase for the new year. In January, you should receive a 1099 form that provides the information about the benefits you were paid the prior year. Then we have the Department of Health and Human Services. They are the federal government agency that is responsible for enhancing and protecting the health and well-being of all Americans. You will find their logo on the cover of the Medicare books that were included with your packet. The Centers for Medicare and Medicaid Services, known as CMS, is a division of the Department of Health and Human Services. They administer the Medicare program. National Government Services, or NGS, is the contracted provider that will process your Medicare claims. The Coordination of Benefits and Recovery Contractor keeps track of how Medicare coordinates with other insurance companies, or who pays first. You might see something from the COB&R if you have Medicare with an employer group health plan or had an accident and the liability or accident insurance is involved. The COB&R is also involved with workers' compensation claims. Please note that your Medicare card will come in an envelope from Baltimore, Maryland with no logo. Medicare Part A is the part of Original Medicare that covers inpatient services. There is no premium if you have enough work credits to qualify for a Social Security check. People who do not meet the work credits requirement have the option to buy into the Part A program. Premiums can be as high as $458 per month depending on how many credits a person is short. There is a $1,408 deductible per benefit period for Medicare Part A in 2020. A benefit period is the way that Original Medicare measures your use of hospital and skilled nursing facility services. A benefit period begins the day you go into the hospital or skilled nursing facility and ends when you haven't received any inpatient care for 60 days in a row. For example, if you are admitted as an inpatient to the hospital, you will have to pay the deductible. The day you go home from the hospital, your 60-day benefit period count begins. If you go back into Part A services within those 60 days, you will not be asked to pay another deductible. If you go back into the hospital after the 60 days, you will have another deductible to pay. It does not matter if you are going for the same reason or something else, so you may be subject to multiple deductibles in 1 year. Medicare Part A covers inpatient services including being inpatient in the hospital, skilled nursing facility, some home health, and hospice benefits. For more detailed information, please see pages 27 and 28 of your 2020 Medicare New Handbook. Medicare Part B is the part of Original Medicare that covers outpatient services. There is a $144.60 per month premium for Medicare Part B in 2020. The Medicare Part B premium can change each year depending on the COLA or cost of living adjustment Social Security makes. Medicare premiums could be less for some people because there is a hold harmless provision in the Social Security law that protects beneficiaries' Social Security retirement income from going down due to an increase in the cost of Medicare. The people who are affected by this law are those people who are collecting both a Social Security check and are enrolled in Medicare Part B. The hold harmless provision stops Medicare premiums from going up in the years that there is no COLA increase in Social Security. Medicare Part B premiums could be more for people who have income over $85,000 for a single individual and $170,000 for a couple. Medicare Part B premiums could also be more due to a penalty for not signing up when first eligible. There is a 10% per year penalty for not signing up. To avoid the penalty, you must be able to prove that you or your spouse were employed and you had insurance through that employment. If you delay Medicare enrollment, there are 2 forms you will need to return to Social Security to sign up. One the employer fills out, and the other is your official request for Part B. Medicare Part B has a $185 deductible per year in 2020, and Part B generally covers 80% of your outpatient medical services, leaving you with 20% responsibility after the deductible has been met. Medicare covers most medically necessary items or services, including but not limited to doctor services, outpatient surgical services and supplies, diagnostic tests, outpatient therapy, outpatient mental health, some preventive health care services, durable medical equipment, outpatient hospital services, blood, ambulance services, and wellness visits. For more detailed information, see pages 25 through 50 of your 2020 Medicare and You Handbook or the blue Your Medicare Benefits book included in the front of your packet. Medicare covers so many things that it's easier to talk about what is not covered by Medicare. The top 3 things that Medicare does not cover are vision, dental, and hearing. However, there are some exceptions to vision care. Medicare does cover services for macular degeneration, glaucoma, and cataracts. Also, because people who have diabetes have a major medical condition that affects the eyes, there is some vision care for diabetics. Medicare does not cover cosmetic surgery, healthcare while traveling outside the United States, long-term care such as custodial care in a nursing home, acupuncture, chiropractic services, foot care including orthopedic shoes. There are a few exceptions. For example, diabetics with neuropathy can get foot care because of their medical condition. Routine exams like checkup, annual physical, or yearly exam are not covered, and prescription drugs are covered by Part A, not covered by Part B. Medicare does not cover yearly exams, annual physicals, or checkups. These services are considered routine and will be denied. Medicare does, however, cover some preventive services. Included in the back pocket of your packet, you will find a white handout that lists the 7 steps to an initial preventive physical exam and a list of preventive services covered by Medicare. The first thing on the list of preventive services is the one-time Welcome to Medicare preventive visit. You can have this visit within the first 12 months you are on Medicare Part B. The 7 steps document provides some additional information about what to expect at that visit. The second service listed on the list of preventive services is a yearly wellness visit. You can schedule this visit every year after you have been on Medicare Part B for 12 months or longer. The back side of the 7 steps document has the details of what to expect at your yearly wellness visit. It is important to ask for these services by name when you schedule, when you check in, when you see the nurse, and when you see the doctor. If you accidentally ask for the wrong service and your appointment does not meet the requirements, you will get a bill. An overnight stay at the hospital does not automatically mean that you're an inpatient. You can receive inpatient or outpatient services at the hospital. Inpatient services must meet strict Medicare guidelines for coverage. Your inpatient stay begins on the day your doctor writes the official order to admit you as an inpatient. This may not be your first day in the hospital. The day you're discharged is also not counted as an inpatient day. Outpatient services can include a trip to the emergency room. You could be checked in and receiving treatment. It also includes doctor services. Outpatient is sometimes called observation stay at the hospital. It can even be overnight. Medicare covers hospital services, but your hospital status, inpatient or outpatient, affects how much you pay for hospital services. Medicare covers both inpatient and outpatient care at the hospital. Inpatient care is covered by Medicare Part A. Under Part A, you have a large deductible, your prescriptions are covered, and if you're inpatient for at least 3 days, Medicare covers skilled nursing services that follow. Medicare Part B covers outpatient care at the hospital. Medicare covers 80%, leaving you with 20% liability. Your prescriptions are not covered under Medicare Part B, and skilled nursing services are not covered following outpatient services at the hospital. Unfortunately, you do not have the ability to change your status at the hospital. It is, however, important to know how your private forms of insurance will fill the gaps that Medicare has left. This is a sample of the notice Medicare sends out to tell you what claims have been submitted for your medical care. Let's take a closer look. At the top of the notice, it will tell you if your claims were processed by Part A or Part B. The notice reminds you that this is not a bill. It's important to look over your Medicare summary notice for accuracy. Check your name, address, and Medicare number. The first page will provide you with the date of the notice and the date range of your claims. Your deductible status tells you how much is processed through Medicare so far, not necessarily how much you've paid. The second column starts by telling you if Medicare approved all services. If no, the number of denied claims will follow. This section also gives you a total you may be billed and a listing of the providers who have submitted claims that are included in the notice. The second page of your Medicare summary notice provides some tips on how to read the notice as well as how to report fraud and get help with your questions. The second column on the second page gives some general information about Medicare preventive services and gaining access to your mymedicare.gov account. Page 3 of your MSN provides claim details. This page starts by defining the columns, followed by the date of service and the contact information for your provider. It's a good idea to verify the details by comparing with your calendar. This is a good way to spot fraud. The first column will be a description of the item or service with the billing code used. Make sure to review these services and ask the provider for an explanation of services you don't understand. If you think a supplier or business is involved in fraud, call Medicare and report the issue. The second column provides a yes or no answer. Was this item or service approved? The amount the provider charged is the maximum amount the supplier charges someone with no insurance. However, Medicare has its own negotiated reimbursement rate for each product or service. This is not what Medicare will pay the provider or what you or your insurance will owe. The next column shows the amount Medicare approved for the service. This is the total amount that Medicare allows a provider to be paid for this service. The amount Medicare paid comes next. It will often be 80% of the Medicare approved amount. There's a big black box around the You May Be Billed column. The amount shown should match with your bill from the provider or your statement from your supplement insurance. The farthest column to the right is the Note section. This section directs you to look at the notes at the bottom of the page. These notes give you some details about the processing of your claims. The last page of your MSN provides you with details on how to handle denied claims. Your appeal deadline can be found on the left side of the page about halfway down. Please note that Medicare must receive your appeal by the deadline. The directions for filing an appeal can be found in the right-hand column with the mailing address at the bottom of the page. If you need assistance filing your appeal, please contact the ADRC and request an appointment with the benefit specialist. But don't wait until the last minute. It's best to contact your benefit specialist right away. That way you'll have plenty of time to gather the appropriate information to support your appeal. Medicare sets the prices that they will pay for each service. This is called assignment. This is an arrangement between Medicare and health care suppliers or providers. Providers who accept assignment from Medicare agree to get only the amount Medicare approves for their services. Providers who accept assignment can only charge people with Medicare or any other health insurance they have the Medicare deductible or coinsurance amount shown on the MSN. Providers who accept assignment must file their claims with Medicare. 95% of providers across the country accept Medicare assignment. Claims are filed electronically to Medicare. If providers do not accept assignment, you may have to pay upfront, and they're allowed to charge up to 15% more than the Medicare approved amount. This is called a limiting charge. This limiting charge does not apply to durable medical equipment or medical supplies. When processing an unassigned claim, Medicare sends a check to you instead of the provider. If you have not already paid the claim, you will be billed for the services and you will be responsible for payment. Medicare covers durable medical equipment that your doctor prescribes for use in your home. There is a competitive bidding program for durable medical equipment, prosthetics, orthotics, and supplies. This program changes the amount Medicare pays for certain equipment and supplies and make changes to which suppliers Medicare will pay to supply these items to you. Under this program, Medicare uses bids submitted by suppliers to furnish certain medical equipment and supplies at a contracted agreed-upon price. This program helps you and Medicare save money while ensuring you have access to quality medical equipment, supplies, and services from suppliers you can trust. For more information or to find a supplier, log in to Medicare.gov and search for Find a Supplier. If you have original Medicare, your healthcare provider or supplier may ask you to sign an Advance Beneficiary Notice, or ABN. This notice means that your provider thinks that Medicare probably won't pay for that service. At the top of the notice, you will find a description of the item or service, a reason the provider thinks Medicare won't pay, and an estimated cost. A big red flag should be going up if you're asked to sign paperwork and you see a price for medical services. On this notice, you will have 3 options to choose from. Option 1 is yes, you want the service, but you want the services billed to Medicare. With this option, Medicare will make an official decision on your claim. If denied, you can file an appeal, but you will have to pay if Medicare doesn't. Option 2 is also yes, you want the service, but you're agreeing to pay the bill. When selecting this option, there are no appeal rights because Medicare never decides. You made the decision to pay the bill. Option 3 is for you to refuse the service. If you refuse the service and the provider decides to provide the service to you anyway, they are not allowed to bill you for that service. After you decide if you want the service or not, an ABN requires a signature showing that you have read and understood the notice. An ABN is not an official denial of coverage by Medicare, but it's a pretty good indication that Medicare does not cover that item or service. The most important thing is to remember that if you're asked to sign something, you should read and understand it before you sign. It's also a good idea to get a copy of any document you signed after it's been signed. If you should have received an advance beneficiary notice and didn't, check the notes section in your Medicare summary notice. Sometimes when an ABN is not signed, Medicare will require that your provider refund you what you've paid for that item or service. To review, Original Medicare is Medicare Parts A and B. Medicare Part A is inpatient or hospital care. Medicare Part B is for outpatient medical services and supplies. There is a premium for Medicare Part B. There are also penalties for not signing up when you're first eligible. Unless you have health insurance through Active Employment Employer Group Health Plan. To sign up for Medicare, contact the Social Security office. The next video in this series will be about your private health insurance options. Stay tuned. The front flap of that packet, you'll find an Elder Benefit Specialist program brochure.